Mm. So I'm a social worker in the state of Georgia. I graduated from the University of Georgia. So go Dogs, we're a huge football school. I have a background actually in journalism, and so I've always been someone who loves stories, and so journalism was amazing for me because I got the opportunity to hear other people's stories, to learn from them and share them with others. And while it was such an amazing and empowering experience for the subjects of so many of the stories I wrote, it felt like I wanted to do so much more. And it felt like there was limits to what I was doing. And so I pivoted into mental health work. And so that's when I pursued my MSW. And I fell in love with this whole process. I fell in love with social work and I fell in love with micro social work, which is like clinical work doing mental health therapy.
Mm.
Um, I became very passionate about trauma-informed care. Are you familiar with the lens focus of trauma-informed care?
I'm really not. I've heard of it, but I'm not the least bit conversant in it.
Okay, so I can like just give a little bit of a synopsis. Trauma-informed care is basically just understanding, approaching trauma and treatment of trauma in a way that is compassionate and also very culturally competent and informed of the client's specific traumas. Um, and it's I think I could have made it a little bit more detailed, but I think that's like a good gist of what it is. That was something I was really passionate about wanting to do and working in, and I wanted to work specifically with women of color. I'm South Asian and Muslim, and there's not a lot of women of color, not a lot of women like me in the field, and there's also not a lot of women like me who pursue therapy, at least down here in the South. And so I wanted to create a space that felt very safe and comforting for women like me to pursue and seek health and destigmatize the mental health field in general.
Oh, that's so important. That's
Mhm.
just so important. I'm so
Yeah.
glad.
Um, and how I came to Magnolia Wellness is, well, I've noticed how my specialty isn't necessarily working with ADHD, but Dr. Edwards and everyone else at Magnolia Wellness, that is their specialty. And I've learned how important like understanding neurodivergency is because it affects so many people. So many younger people are being diagnosed with it, and there's such little literacy on how do we even address this or work through this. And so that's kind of something I'm getting to learn a lot about here at Magnolia Wellness.
Good, good. Many older people, not necessarily old, but adults are
Mhm.
now getting diagnosed as well, many more than used to be.
Oh, wow. Yeah. And that's what you said you worked with, correct?
Yes, yes, I work with adult professionals, primarily women.
Mhm.
Um, my practice is probably 70% women, 30% men.
Oh, wow.
And most of them have gotten diagnosed in their 30s, 40s, or 50s.
Mm.
So just recently.
And I can imagine that a big part of that is so much ADHD research was focused originally on men,
Oh,
correct?
oh, yeah,
Yeah.
yeah. In fact, they wanted to do a study on hormones and how hormones affected ADHD, and they did it on men.
That interesting.
For real.
Wow. Okay. And so I'm guessing, are they doing more research now on women, would you say?
Yes, yes,
Okay, that's good.
they are. Not enough, but it's beginning.
Okay. Okay, we can move forward. So I did want to kind of start with like putting a definition towards what generational or intergenerational trauma is. On the left of the screen, you can see some of the some symptomology that we see in the DSM-5 associated with trauma. And these are the ones that I see a lot of like newer research associate with generational trauma specifically. Um, and so the APA defines generational trauma as the transmission of trauma or its legacy from the generation experiencing it to subsequent generations. And I do want to, so I'm having to switch back and forth between the slides and the call, but I wanted to break down the definition of it. And so basically, when trauma isn't addressed or healed, it doesn't just disappear. It lingers within the individual. It often manifests in behaviors or attitudes or emotional responses that can negatively influence their relationship and interactions with others, especially their children.
Hmm.
And that's something I want to be I'm going to be talking about a bit today, is not just intergenerational trauma and its focus on one person, but how it can affect and show up in the way someone parents and how it shows up in the way that their child is raised. So I've broken down some of the ways in which intergenerational trauma can show up in multiple generations. So we're going to go into each of these in greater depth, but the four that I have picked out are physical manifestations, behavioral patterns, cultural and social practices, and emotional and psychological patterns. So first, we're going to discuss physical manifestations. We already know that from a lot of research that experiencing trauma for a prolonged period of time can manifest into physical chronic health issues. Some now emerging research is now suggesting that subsequent generations following a traumatic incident can also be impacted and be at higher risk for developing those same health issues. And some of these are things like heart disease, diabetes, stroke, and liver disease. Um, I have listed at the bottom some studies, and afterwards I can share the links with you. But some of these kind of show studies from research done on different communities that have experienced prolonged exposure to trauma. So some are Holocaust survivors, some are the descendants of certain Navajo nations and indigenous communities, and how you can cover some of the ways in which certain health issues, like the ones listed here, have passed down. And a lot of the reasons responsible for this are what we presume to be genetic, but also things like the ethnic and racial health inequality in our healthcare system. That does play a part in this. And I want to talk about that in more detail in a little bit, but there is a lot of mistrust in our healthcare system. And so certain communities do feel distrust towards acknowledging both their physical and mental health issues, and which is part of the reason why we see some communities not going to seek out help in America. And I'm gonna touch on this, but I'm not gonna go into too much detail because this is not my area of specialty at all. But epigenetics is like the study of genetics and the study of gene markers and how things can be how gene markers can be altered. Um, But many researchers are now believing that generational trauma can be epigenetic, which basically means that significant trauma can and may possibly impact DNA and gene function. And this is really new research, so um, they're not too certain of how it works or if it is even possible, but it's something that they're considering.
Wow.
I know, it's very interesting. I think a book that talks about this in great depth is Body Keeps the Score.
Oh, yeah, I have that.
That So it's very interesting, like new research that's coming out about this. Okay, and now we're going to talk about behavioral patterns. So some behavioral patterns that we see in clients who have experienced intergenerational trauma is things like dysfunctional coping mechanisms, attachment issues, and having a difficult relationship with the concept of control or a propensity for perfectionism. Some of the unhealthy coping mechanisms you may see in these types of clients are things like substance abuse, overeating, and self-harm. Children raised in families with a history of trauma may likely have an insecure attachment style. And in families with a lot of unpredictability in their past, control may have been used, and it may still be used as a defense mechanism. And this can apply to unpredictability in financial stability, like housing or access to groceries. It could also be related to physical instability and like or uncertainty about physical safety as well. Okay, now we're going to discuss some cultural and social patterns. So the trauma associated with cultural displacement and identity doesn't necessarily end with the first generation. A sense of loss can be transmitted to children and grandchildren, and this often manifests as anxiety or a deep sense of cultural inadequacy. The next generation may struggle to reclaim or redefine their identity in the absence of like a clear cultural framework. So someone who is a second or third generation immigrant may struggle a lot with this identity work, which is something we see a lot in therapy work. I'm sure you see this in coaching as well.
Mhm.
Um, Cultural norms dictate how trauma is perceived and whether it's acknowledged. So, in some cultures, trauma may be stigmatized or seen as a private matter, which leads a lot of individuals to suppress their experiences instead of seeking help. This silence can cause trauma to fester and unknowingly be passed down to the next generation. But social support systems can help. So, the presence of social support systems can play a big role in how individuals and families cope with trauma. In cultures with a great community network, there may be opportunities for healing. Um, and things like shared experiences and collective resilience play a big role in cultivating support within these systems. However, certain societies, which I think we see this a lot in America and a lot of Western ideals, this idea of individualism and individual identity is very emphasized. And so people may feel isolated in their trauma, increasing the risk of transgenerational, intergenerational transmission. So passing things on to the next generation. Okay, so I mentioned that I was going to go back into this, but talking about discrimination and distrust. Discrimination is like a really powerful experience for many individuals and communities. It can lead to these deep-seated feelings of distrust, and these feelings can be internalized and passed down to the next generation. It perpetuates the cycle of fear and disempowerment. And I actually have like an example that I want to discuss. I'm not sure if you're familiar with the Tuskegee experiments. This is a pretty recent example. This was done, I believe, between the 1930s and the 1960s in America. So the U.S. Public Health Service wanted to study the progression of syphilis if it wasn't treated and wanted to see what that would look like. And so they experimented on approximately 600 Black men who they would come into their doctor's offices and they would have syphilis. And the usual treatment at the time was penicillin, which is what we still use today to treat it. And instead of being given penicillin, they were given a placebo without their consent. And unfortunately, this caused a lot of these men to die, and it caused a lot of them to pass on the STI to their children and their spouses. And one of the studies I listed down here reported on some of the descendants of some of these victims, and this was done in like back in 2021. Many of those people in these communities still deny surgery or emergency procedures unless there's a Black physician present to do it. Many of them avoid seeking medical treatment or medical issues unless it's progressed to too late of a stage. So we can see how this has created like a deep mistrust of public health officials and physicians, specifically white physicians in the Black community overall. And we still see this today with the specific families that were harmed by this experiment. So now we're going to go into emotional and psychological patterns. Trauma can lead to internalized negative beliefs about oneself, such as feelings of worthlessness, shame, or guilt. I think internalized shame is something we see the most prevalent in all of the research I've done for anyone who's experienced generational trauma. This can reflect in how they behave and how they behave as parents. And so this can look like limiting their child's self-worth to specific things like their academic success, or limiting their self-worth to how obedient of a child they are to authority figures. And they may have had those internalized beliefs themselves, or it may have been something that was internalized to them from their parents. And when that shows up in the way they treat and parent their child internalizes those beliefs. They grow up with the same internalized belief that their self-worth is linked to these things and will inherently parent their children in a similar way, unless they, of course, sit with and acknowledge and are able to process and heal from their generational trauma. So, to cope with trauma, many individuals may also cope with using certain psychological defenses, such as denial or avoidance, which are the ones I have listed here as examples. These mechanisms can be modeled by parents and then adopted by their children. It becomes a default way for dealing with difficult emotions or situations, even when there are healthier coping strategies available. Okay, so all these patterns that we have discussed as of now can have a significant impact on the mental health of many of the clients that we both see. They contribute to chronic anxiety and depression, low self-esteem, internalized shame, and difficulty in maintaining healthy relationships and healthy boundaries with those relationships. I can imagine in consideration of working with adults with ADHD, it can also create an impact on internalizing a lot of shame associated with identifying with having ADHD.
Mhm.
So I do want to talk about some of those approaches that are recommended in treating generational trauma. And in doing so, we do need to make sure we're acknowledging the multifaceted nature of generational trauma. So the best approach would make sure to address these 4 areas and maybe even beyond this based off of the needs of your client. But I'm going to start by talking about this one specific model. It's called the Intergenerational Treatment Model, or ITTM. This is a model that's it's a program specifically designed to provide complex trauma treatment for both a parent and a caregiver and a child at the same time. And the thing I like about this model is you can take pieces of it and use it with if you're working with just an adult figure who is processing and trying to heal from something they've experienced in their past without their caregiver or their previous parent in the picture. Um, so I think that there's a lot of valuable parts that you can take from this. It's conducted in 3 specific stages. And so phase A is caregiver psychoeducation. And this is pretty self-explanatory. So the caregiver or the parent is given psychoeducation on trauma, how it works, how cognitive distortions work, and how they affect a person's behaviors. And then it also provides, in this specific model, psychoeducation on how their behavior and internalized beliefs are affecting their children. Phase B, caregiver trauma. This addresses the initial trauma. So whatever the primary trauma was in the very beginning. Or the traumas. So based on the image you see here, this program aims to target the root first. So this is kind of like a bottom-up approach to trauma work where you target the initial problem and then you work your way up to all of the behaviors that are presenting now in that person. The caregiver is supported in identifying their negative self-beliefs in this phase, and it's grounded in whatever those negative self-beliefs are that are grounded in the initial trauma or traumas. The caregiver then enters a process to resolve those core negative beliefs. In this specific model, I believe they like to use CBT to do this. However, I think somatic interventions may also be helpful. I think narrative therapy may also be helpful. And I'm going to talk about those a little bit more later on as well. Finally, phase C is the child's trauma. So this addresses the trauma of the child. And I think this can be pretty flexible. It can look like giving space for the child to one-on-one address the trauma with a clinician or a coach, like done in phase B, and then later on bring in the caregiver for a few sessions for them to work together. Or you can have both the child and the caregiver in these sessions actively participating together. The overall purpose of this final phase is to ensure both the caregiver and the child are on the same page and that the child feels heard and understood by the parent, and that they both are understanding and establishing future healthy practices together. So this model is specifically designed for a parent or a caregiver to be involved with their child. And I think a lot of elements of this can be taken and used when working with an adult who is later on in life seeking help with their trauma without their parent or caregiver there to acknowledge or support them.
Will you be talking at all about adult children who?
In my next slide, I actually have a few interventions, and I'm going to I can talk about how those can be beneficial to adult children.
Okay, thank you.
Of course. Okay. The intergenerational treatment model that we just talked about is informed by attachment theory and trauma theory, which I think you can use both of to heavily involve when working with an adult child who is dealing with generational trauma. So I think the most helpful thing is understanding the attachment style they have, understanding the internalized beliefs they may have internalized from an adult figure in their life or from the traumas that they've been re-traumatized by from the previous generation, And I think that's a really good starting space for that. I mentioned narrative therapy earlier. I think this can be really helpful in helping someone reframe and rewrite the stories they tell about their lives. Are you familiar with narrative therapy?
Familiar with, not
Okay.
well versed, but familiar.
I think so. I think the most helpful and empowering part of narrative therapy is you're allowing them to tell a story. And so this is why I love it so much, is because this is something I used to do a lot, is you put them in the chair and you tell them, okay, tell me a story. Tell me the story of your life. And they're going to be speaking to you about this. And they're obviously going to have so much color and language in the way they speak to you about this. And it may not be the most positive light, or it may be an incredibly subjective experience for them. And so you're offering them the alternative experience. So every step of the way, as they're sharing their story, you're pausing them and saying, okay, but what if? And then you're offering the, if not objective, because it's really hard to be, the other side of the subjective experience. Um, I think this can be really powerful in helping clients separate themselves from their trauma. And it helps them like rewrite what has happened to them in a way that can be really empowering for some people. They can and like in doing so, you can have them identify what strengths have they like picked up or accomplished through their life as they're sharing this story. And so that can be really empowering for them to be like, okay, well, I have this and this and this on my like life tool belt now. And these are things that I've learned from the experiences I've had. And that can be really empowering and helpful. Okay, I do also want to talk about IFS, or internal family systems. So this is an approach that I think it's very visual. So for people who are very visual learners, I think it's very helpful. It's an approach that views the mind as made up of different parts, and that each part has their own perspectives and emotions and roles. And so it helps people who are feeling really overwhelmed about, I have a lot of feelings in me, or I have a lot of conflicting feelings or thoughts or beliefs or values, which can happen a lot, I think, with people who have experienced generational trauma to the extent of their parents had very different values from them. And they may have internalized a lot of those, but that doesn't necessarily mean they align with that person's own personal values. And so in the context of generational trauma, IFS helps clients identify and heal the different parts of themselves that they can identify carry burdens that maybe their caregivers or parents have passed down to them. So any negative self-beliefs that their parents may have internalized and then passed down to their children through the way they parented them, you can help acknowledge those and identify those in your clients. I know some people love doing this visually, like with a chart. They'll give their client like a physical chart and colored pencils and be like, let's color out the different parts of you that feel these different ways. So you can do this with feelings separated from emotions, or sorry, feelings separated from thoughts. So here's how I feel about myself as a person, and you separate those different feelings. And then maybe if you want to do thoughts, so if there's a very specific situation that they're feeling conflicting feelings about, or they're conflicted in how they should address it, splitting up a wheel, or like using, I think of people like to do this also with like physical things, like they have a bunch of colored cards and I'll say, okay, which color represents which different thought, and let's tear off the pieces and like make them fit into something. And so I think this is very helpful. I'm getting very art therapy, I think, into this, but you can be really creative with IFS and parts work. Um, and so it helps them, like I said, identify and heal parts of themselves that carry the burdens that someone may have passed down to them. An example of this that I have mentioned here is like a protector part. So maybe a part of them, it feels like a protector may have been developed, and this protector part of them feels the need to protect against the pain of the trauma that has been passed down to them. And so that protector part is maybe responsible for defensive behaviors, like when they feel very defensive in an argument against someone, or if they feel very protective over their parents when someone comments on a certain behavior their parents used to do to them as a child. So identifying those different parts of them and saying you can acknowledge the protector part of you while also acknowledging there's a part of you that's also hurt. And so being able to list and name those different parts, I think, can be really helpful. And then I also want to talk about some somatic interventions. So I'm not someone who does a lot of somatic work, but I do think it's really interesting and it can be really helpful for people with trauma. Um, It helps them become more aware of the physical sensations in their bodies and how these relate to emotional experiences. I'm not sure, are you familiar with many somatic interventions? Or
No, I am familiar with somatic intervention, somatic therapy, and somatic coaching. I've taken a class in it.
oh,
So
nice. Is there any that you specifically like enjoy using with your clients?
I use mindfulness and body work.
Oh, like body scans?
Yes,
Okay.
yes, exactly.
So I think those both can be really powerful because you're helping your clients understand where they're feeling things on their bodies. And so
Exactly.
I think this can work hand in hand, kind of with parts work. So like a part of me feels pain, or a part of me feels like feels fear. And you can help them identify where they feel that in their body.
Mhm,
And you can separate that from all these other conflicting feelings. But I also feel sad for my caregiver for the things that they've done, or for the life experience that they've had to have. Or I
mhm,
feel forgiving, or I feel gratitude. Like you can help them piece apart these different feelings and where they feel them in their body. I also think a common symptom I think I mentioned earlier with generational trauma is chronic anxiety, hypervigilance, chronic tension. And so I think somatic work can be really helpful in helping these clients feel safe in their bodies, especially if there was a history of their parents not feeling safe in their bodies and then translating that down to their children.
mhm.
That is really all I have prepared for today. So if you have any questions, I'm happy to answer any that you have to the best of my ability.
Um, what I'm finding is interesting.
Mm,
Two things. One, personally, my grandparents were immigrants, so and were tremendously discriminated against. Then my parents, being first generation, also carried that. And I'm realizing I have some of that as well. And then wondering what I may have passed to my daughters.
mm,
Um, Second, intergenerational trauma is subtle.
it is.
It's hard to piece that apart uh, from being able to identify a specific trauma in your own life.
Hmm.
This is something where you need to dig deeper.
It really is, yeah. And I think, let me go back to this. I think this diagram or this image here really reflects what's most helpful when understanding, helping a client dig deeper is you have to start at the root.
Yeah.
So a client comes in and says maybe, oh, I'm struggling with my relationship with my daughter. We don't get along well, and it's the most stressful thing that's happening in my life. And so rather than starting with the relationship with their child, you ask them, okay, take me back to the very beginning. Let's talk about your childhood.
Mm,
And then I think this is where the narrative therapy comes.
mm,
So you ask them, let me hear about these little pieces of your story from your childhood. Tell me about your relationship with your mother and your relationship with your father. What are some of the belief systems that will come out as they start sharing their story? So you look for those little pieces. And so it is subtle. And so you have to put a lot of careful attention, I think, into picking up on those subtleties in the negative self-beliefs they may have adopted from their parents.
mhm. Yeah, yeah, definitely.
Yeah. I also think some clients are like very self-aware. And so when that happens, they may just list a bunch of things and be like, "Oh, I know everything, but I still don't like know why something just feels wrong." And when that happens, I think, because I think I've seen that in quite a few clients recently. And what I've learned is they may know what's wrong, but they don't understand it, and they don't have any compassion or understanding for themselves in that process of understanding what has happened to them.
Yeah, they just feel the um, the pain of
Yeah.
it,
Mhm.
and the potential dysfunctioning in society, and don't understand the root, as you said.
Yes, definitely.
Yeah. Yeah. Well, thank you. This is really fascinating stuff.